So I'm very excited to announce our guest here today, Sandhya Ramanathan, a general practitioner based in Auckland, New Zealand, who recently has been in the news for her breakout viral video on home management of COVID-19. And today she's here with us on this platform, Transform with Neha. So hello and welcome, Sandhya Ramanathan.
Hi, Neha, and thanks for having me. Very excited to be on your wonderful show, all about transformation, which we all need.
Yes, we do. And, today what I would like your input and help on is to help people understand depression and anxiety better, because something tells me that in these times that we live in and also going ahead, we're going to see rising rates in DNA. I'm not talking about human DNA, but I'm talking about D and A, depression and anxiety.
Today, it'd be really good to address the whole issue of mental resilience, which is extremely important, not just now during the pandemic, but always. And, you rightly mentioned that, rates of depression and anxiety and, people talk about suicide and all sorts of things, could be a byproduct of this pandemic. But mental health issues, depression and anxiety, is incredibly common, full stop. I mean, I would say a third of the patients' problems that I deal with are pertaining to their mental health, whether it be depression, anxiety, a mixture of both. And what I'd really like to do is actually just demystify that whole process and, encourage people as much as possible to, talk about their mental health, address it, especially if it's, causing so much problem that you are unable to function and do what you're meant to do from a day-to-day point of view. Then just like any other illness, whether it be a physical illness like, breaking your foot, you're not going to just ignore it and, not go for an x-ray and not get it, plastered and fixed. Same way is if you are having, any issues with, depression or anxiety, such that you are unable to, function and do your daily activities. It is extremely important that you address that problem and you go and you see a medical professional without any fear of being judged, without any fear that what you say might be held against you, because that's not a concern at all. We are here as professionals, whether it's your family doctor, whether it's a psychiatrist, whether it's a psychologist, whether it's a counsellor. We are here to help you so that you can get back on track. And the good news is, it actually doesn't take a lot to get you back on track. So now I think this is a very important topic, and I'm really glad you've asked me and invited me today to speak about it, because it's an area that I'm very passionate about.
So, Doc, what is depression?
I can talk about both depression and anxiety because they're sort of a spectrum. But depression, if you want to look at it, depression and anxiety are two normal human emotions. We all feel, sad at times, and we all feel anxious or worried at times. So with depression, what I generally explain to my patients is that we all know that life has ups and downs, just like a wave. Life has ups and downs. Kabhi khushi, kabhi gum, like the iconic Bollywood movie. So what depression is, very simply, is when you are stuck in that down and you can't see an up. And as I mentioned before, that basically means that you can't function from a day-to-day point of view because you are overwhelmed with those feelings of sadness and hopelessness, to the extent that it can actually affect your physical functioning, whether it's, you'll have, tiredness, loss of motivation, possibly loss of appetite, you'll have a sleep disturbance, you may even suffer from constipation. These are all sort of things that physical manifestations of your low mood. So just like life is colourful with its ups and downs, if you can imagine that you're only on that down, it's just like your life is flatlined you know, and you need to come into the doctor so that we can get that line going up and down again. Coming to the doctor is not going to take away the fact that you will have downs. You know, we're not going to put you on a happy pill and take away the ups and downs of life. There is no such thing. But what we are going to try and help you do is get back on track where you can sort of see that you are back on that, productive and meaningful life. You know, because the worst thing possible is when you're not productive, when you're just basically in a state where your mental state doesn't allow you to do anything. So that's sort of depression in a nutshell. With anxiety, what happens is that you have these overwhelming, feelings of, fear and anxiousness. And so for some people, they even get panic attacks. Now, anxiety happens basically when people generally spend all their time thinking about something that happened in the past or worrying about something that happened in the future. And very little of the time is actually spent in the present moment. Now, the important thing to understand with anxiety is that it can make you feel terrible. It can make you feel like you're about to die. That's when people have a panic attack, they think, oh my God, I've got chest pain and I can't breathe properly and my, extremities are all tingly. And all of those symptoms are basically caused by over-breathing or by hyperventilation. Without knowing it, we, start breathing rapidly and in a shallow way. And by doing that, what happens is we change the oxygen carbon dioxide balance in our blood. And that drop in that carbon dioxide balance in your blood basically causes you to have these feelings. So that's a very key thing to understand, because you yourself, if you learn slow breathing, which I will talk about, are able to control those feelings of intense anxiety. So that's always something that I go through with the patients, because it often overlaps. So if somebody is to come in and complain of, either depression or anxiety, I would first of all congratulate that person for coming in to see me, because I think that's a great job. You're already there in terms of getting better, because you've done the most difficult thing. You've come in and you've admitted that you've got a problem, and that now we're going to do something about it. It's extremely important. I mean, I can't state enough how important that step is, and I would encourage everybody to please, please, please don't suffer in silence, because this is something that is so fixable, that I would encourage you to please, go, and don't be afraid. I mean, we don't look that scary.
Yeah. You
can come in and sit.
You heard what the doctor said. A lot of people, doc, right now might be feeling stuck, physically stuck, because, we're restricted to our homes, and, our mobility is restricted right now. And I just wonder whether people can confuse feeling stuck with being depressed, or can feeling stuck be the first step to actually a deeper problem going forward?
Well, that's a fantastic word that you've used, Neha. And in fact, being stuck is a very good description for by far and away the most common presentation to the doctor with depression and anxiety. People have this sort of mentality that, oh my God, if I say something, the doctor, will send me to the mental asylum or the loony bin. That's it. That's the end, and it's a big shame, and there's a big stigma associated with it. Well, no, it's not actually the case by far and away. And in fact, this has been the whole trend in mental health over the last few years, is to move away from labeling patients as being, depressed or clinically depressed or anxious, but more like exactly what you said, thinking of it as being stuck. And generally, it's because of whatever situation life has thrown at you. For example, at the moment, this pandemic, this 1 in 100-year pandemic, which has, thrown us all off kilter. And I don't think there is a single person in the planet who hasn't had some element of, feeling sad or worried about the situation. Because let's face it, we're all human. And, nobody expected that we would lose normalcy in such a big way, and so so suddenly and so unexpectedly. So so knowing that we can very easily, once you've actually recognized that you are stuck and that you talk to somebody about it, it's actually quite easy to actually then move from that point. And we have various modalities available to us as clinicians, where we can in partnership with the patient, basically work through the problems in a meaningful way to get you back on track.
So some sort of a home test that one can kind of, or an app or something that you would suggest that we can do at home?
I mean, there are a lot of great apps, and regarding mental health, there's a lot of wonderful stuff online available. I think in terms of a home test, I mean, I think one of the simple things you could probably do is, if you found that you were, overcome with feelings of sadness to the extent that you were, breaking into tears all the time, or you were so anxious that, you just couldn't get over those fears. Probably something very simple I could ask you to do is try and think that if those tears or if those fears that you are feeling were words, what would they be saying? And just write that down. And, that's actually probably a very useful exercise, because
I love it. It's fantastic. It's
yeah,
fantastic.
because, that's, you're halfway there actually, once you've actually sort of acknowledged, oh, hang on a second, because there's two things. One is the emotion and the other is the problem. So you've got to separate the two. And this is a really good exercise, because once you've actually written it down, and then you can actually own it, acknowledge it, and then you can start letting it go. And that's something that we, would try and do, even in a consultation, if possible, if somebody came in. But that's something very simple that you can do. In writing that down and owning it, it is also very important that you talk to somebody about it. Whether it's, a trusted family member, you ask them, if you're a young person, a sibling, a friend, a school counselor, somebody. And that you seek some professional help, because you'd be amazed. It doesn't take much to get onto the path of recovery, and you'll never look back. You'll feel a whole lot better, and you'll probably recover from this much faster than your broken foot, to be honest.
What would you say to all those people out there who feel, this sense of they can't confide in a counselor or a doctor, or if they share that information with them, it might go back to their parents when it comes to teenagers, or for adults, it's just the confidentiality aspect of things is what may concern someone and stop them from going out and seeking that help.
Yeah, again, that's very understandable. And I mean, again, it's a complete myth, because we have quite strict codes of confidentiality. I mean, I know, as a primary care physician, as a GP, and there's only a couple of situations in which you would have to break that confidentiality. And one is if you assess that patient is at risk to themselves, like they're a high suicide risk, for example, or they're at risk to somebody else. But apart from that, generally everything that you tell is confidential, and you have the full rights to, even if you're a child, a younger person, to one-on-one confide in your doctor, and not be worried about those issues at all.
Okay, so say I have acknowledged my problem, I have found a credible counselor and doctor who I would like to visit. Now I've gone and I've met the doctor. What's going to happen then? Like, what is the process once I meet a doctor and tell them that I think I'm depressed? Help me.
Just when the patient comes in, just one very simple thing that we do is we have some tools, which are simple, forms, that, and there are several different types, which help us, quickly in 5 minutes run through what you may have been feeling in the last week in terms of levels of sadness, levels of hopelessness, and sleep disturbance and, feelings of anxiety. And what that helps us, that quantifies your level of mental distress that you're feeling, and possibly helps us decide whether you're more, on the depressed side or more on the anxious side. But that's a very valuable tool, because then we can then use that again to go back and refer to as you are getting better. So once we've done that quick thing, we quickly move on to the management side. Now, in the recent years, there's been a very big shift away from, antidepressant prescribing. Now, antidepressants work on both anxiety and depression. So, it's a multi-purpose medication. They are safe and they are not addictive. But what I explain to patients is that there are two components to any, depression or anxiety or, mental health imbalance. One is the chemical balance in your brain. And second is your coping mechanisms. So that the only role of medication is to work on that chemical balance. And very rarely will I actually prescribe somebody an antidepressant in the first time that I see them, because actually most of the studies have shown that of late that really, they're just as good as just taking a sugar tablet, or what we call placebo, that we're better off doing things like exercising every day, which is going to naturally help with the chemical balance in your brain by, giving you natural endorphins. And I know people will get back and say, but we're in lockdown, our movements are restricted and we can't go out. Well, no, that's not the case. There are a lot of exercises that you can do at home. And I would say yoga is fantastic, because as we mentioned about breathing, and also meditation and mindfulness, is it's very easy to tell somebody, go and meditate, but it's very hard to do, even for me, it's very hard to do. The wonderful thing about yoga is that it is, you're focusing on breathing, but your body is moving at the same time. So, by default, you're not ruminating on the past or thinking about the future, because you're so busy concentrating on what you're doing and breathing along with it, that it's incredibly good for your mental health, be it depression, be it anxiety. So so in my prescription on that first consultation, regardless of the age or the extent of the depression or anxiety that the person may be suffering, is that they must exercise. And I teach them a very quick breathing exercise, which I get them to practice daily, but when they are well, when they're not emotionally distressed as well, so that when they do start feeling those overriding feelings of depression and anxiety, they can switch it on straight away.
So can we do that?
Yes, sure.
Now, and
yes, it's very simple.
Everyone who's watching can do it along with Sandhya and me. So what exactly do we have to do? So you're saying this is something that we have to practice daily, so that it becomes reflex, so that at the time we are feeling anxious, so we are feeling, the distress signals in our brain are kind of going off, we can tap into this to kind of calm things down.
Exactly. Yeah. And it will make you feel better.
Please get ready, everyone. Let's face Sandhya wherever you are, and shut our eyes. Should we shut our eyes for this?
You can shut your eyes, but what I'd like you to do is I'd like you to ground yourself and, lightly place your feet on the ground so that you know that where you are in time and space. And I'd like you to put one hand on your chest and one hand on your stomach, okay? And I want you to imagine a box, okay? And what we're going to do is we're going to be drawing a box as we are breathing. All right. And what we're going to be doing with that box is we're basically, the top line of that box, we're going to be drawing across as we breathe in to the count of 3. Then we're going to draw the line down in our mind as we hold that breath. Then as we breathe out, we're going to draw the line across down the bottom. And then we're going to hold and we're going to draw the line back up. So basically what's going to end up happening, Neha, is that we're going to slow our breathing, and one breathing cycle is going to end up taking 6 seconds. So in 1 minute, we're going to be having 10 breaths, okay? So basically you're slowing your breath down to 10 breaths a minute. All right, so mentally you're going to draw that box, but the other point of having the hand on the stomach and the chest is that we want our breathing to be abdominal. We want it not to just come from the chest cavity. We want it to be diaphragmatic breathing. So you want to feel that stomach moving in and out. Okay, so now that I've told you, let's do it.
Okay.
All right? Okay, so I'm going to breathe in to the count of 3. Then I'm going to hold, and then I'm going to breathe out 4, 5, 6. Okay? Big breath in. 1, 2, 3. Hold. I'm drawing the line down. Breathe out. 4, 5, 6. Draw the line up. So you can see how that immediately brings a sense of calmness and brings you into the present. And that's a very important exercise to do, as much as you can. And because, that's your natural tool, defense mechanism to fight these overwhelming feelings that you may feel.
I like how you added that whole visualization of the box, because it took my mind away from whatever else I was thinking. Maybe what am I going to ask Sandhya next? Or, for me right now, since I'm here in this interview with you, or having these questions in my mind while we were chatting, suddenly I just felt like it all went away. My mind refocused to this box that I'm breathing in and out with. And that really helped me disconnect.
Yeah, I mean, we are visual people, so visualization is extremely important. And in something which we all take for granted, we breathe, but we don't breathe well. We can all improve our breathing, and that's very important for our mental
Everyone's
health.
talking about it, Sandhya. Everybody talks about how important breathing is. But I think so many of us are hearing it, we're not listening. Hence, we're not doing it. And it's only when, like, I hope people watching this try this exercise out and do this, because I think, I can feel the change in me right now, not just in my mind, but even in my body right now. I can feel that sense of calm and
100%.
presence.
And the thing is, and breathing, I mean, it's important for, as you said, our mental resilience. But in this context of the, COVID-19 pandemic, everybody should be working on their breathing. And in my video, I spoke about the importance of, the exhale. I mean, I know personally, when I sort of made that connection myself, it was like an aha moment. I was like, all this time I've been focusing on this big breath in. Actually, if you just focus on one thing while you're drawing that box and it's breathing out really well, when you go to take that inhale, it's going to be a reflex and it's going to be a deep inhale. And you would have been happy that you have emptied your lungs as much carbon dioxide and you're going to get as much oxygen in. So, I mean, again, it's something very subtle, but giving your brain something to focus on rather than, oh my God, I've got to inhale and then I've got to exhale. Just focus on the exhale and draw that box. And hopefully that will make it a lot easier for you.
So can you quickly summarize some of these coping mechanisms that people can, apply at home when it comes to, better mental well-being?
As I said, I think the first step would be, recognizing and acknowledging if whatever mental health issue you're having, be it depression or anxiety, is it so all-pervading that it has caused you to stop functioning properly and doing your day-to-day activities, and it's causing problems in your interpersonal interactions, with your family members. I'll give you an example. Just during the lockdown, I had a consultation early on in the lockdown from a gentleman in his late 20s who probably always suffered from social phobia, but he was quite distressed, and again, it was a telephone consultation, which made it a little bit more challenging, but he worked for an overseas call center, and he, because of the increase in the sort of live calls that he had to do, he just couldn't cope. From his social phobia point of view, he just couldn't cope, and he couldn't work. He couldn't do his job. He loved his job, but he just got to the point where the anxiety was so much that he just couldn't do it. So although he's always lived with a level of social phobia, at that point, what caused him to come and ask me for help was the fact that he couldn't do his job, you know. So, you know, the level of anxiety in his voice when he first called me was so intense at the beginning of the call. But by the end of that, you know, 10-minute conversation, I could actually hear the anxiety go away. You know, I could hear him calm down just by, you know, admitting that this was an issue and that he couldn't cope. And, you know, very quickly over the course of, you know, maybe 6 to 8 weeks of the lockdown over 5 telephone consultations, he's a whole lot better. I mean, in his situation, I ended up having to put him on medication. But again, that was for the short to medium term while he had attended counselling sessions, again, virtually, to help him cope with whatever issues. And the last time I spoke to him, he was back happy at work, but he was starting to now address his social phobia as the next step. So that's just one example. So the first point is that you need to understand whether this is just, you know, I'm just a little bit stuck, or whether I'm a lot stuck. You know, whether you're really, really badly stuck and you need somebody to just help dislodge you a bit, okay, fine, go and see a medical professional. If you're just a little bit stuck, that activity of just, you know, taking that intense emotional distress, be it sadness, be it worry, and just, you know, take those tears and fears and write them down if they were words, and just acknowledge it and accept it. And that in itself is something very therapeutic. And I would actually say that keeping a diary is actually a very good thing. You know, we're all about the smartphone and all about, I've still got my old diary, I must say, because, yeah, there you go. We're soulmates. You know, like, because you actually have to see it written down. I mean, I might lose my phone, you know, I won't know what I'm doing.
I stumbled upon this thought that when you actually physically write, there's just something about what's happening in your body, in your nervous system, and your mind-hand connect. I mean, I don't know how true that is, but it works for me.
Oh, it's definitely 100%. I mean, if you want to memorize something, you have to write it out. It's an important thing. Anyway, I mean, the thing with the diary is, apart from a practical thing, like from a COVID point of view, writing down where you've been for tracking and all those things, which is eminently useful, is that you can do many things. One is that you can write down things that you should be thankful for, or what they call a gratitude journal, like just 3 things on a daily basis. Like, I'm glad that I'm alive, you know, I'm glad that, you know, I had a nice meal, you know, simple things like that. The other thing is that one of the significant symptoms or side effects of this mental disturbance is sleep problems, you know, insomnia or lack of sleep. And so I often tell patients to have a diary by their bedside, and before they go to bed, write down whatever's worrying them. Or, you know, it might be something that they're thinking, oh my God, I might forget if I don't do this tomorrow, or I haven't got through this, or and once you put that worry down onto paper, then take it out of your mind and then just focus on trying to go to sleep. So that's something very simple. So we've talked about breathing. We've talked about writing things down, acknowledging your fears, being grateful, writing down worries. We've talked about exercise, and, you know, it can be cardiovascular, but yoga is actually very, very good. And, you know, it doesn't have to be anything really intense. It can be a 20-minute YouTube video on yoga that you can follow. And it will make a big difference to the way you feel. Apart from that, it's really the important basic things like having a routine, you know, eating well, and staying connected, you know, communicating with your loved ones. Because, you know, funnily enough, a lot of these problems not only, I would say, have become major because of the pandemic, but these feelings of isolation have become greater since we've all become more ensconced or involved in our unreal world on our smartphones. And, so whatever connections you're having, you've got to make sure that they're real connections, with your family members or with your loved ones. I mean, it doesn't have to be a physical connection, although, physical connection is nice, but it has to be a real one, like this conversation that we're having. It's very different from scrolling through Instagram feed, where it's all artificial. There's no real connection there, because whatever image that other person is projecting is through a filter, most likely, and it's artificial. It's only, you're not actually connecting with them in a meaningful way. So I think that is also very important. So I mean, I think it's basically an issue of acknowledging, that that there's something wrong, and then doing something about it, and being okay with yourself, and showing some compassion, and also understanding that it's incredibly common, and that there will be so many people you don't even know, and that they are taking, they may be taking antidepressants, they may be dealing with other things, you don't know. And the same way, but they're leading extremely highly functional lives. But the difference is that they're actually coping. And another point I'd like to bring up, Neha, is that it would be far better to go and see a doctor, or even to take, an antidepressant tablet for, a short period, or, a medium period of time, or even if it's a longer period of time, that's going to cause no harm. But unfortunately, a lot of what people do is they self-medicate. They self-medicate with dangerous substances, things like smoking, drinking alcohol, taking recreational drugs. By far and away, the most common reason people are doing that is because they're trying to self-medicate for those feelings of sadness or those feelings of anxiety. But what they're doing is they're actually damaging their body. And I would say your body is a temple, worship it. Don't damage it. And, it is far better for your health if you are feeling those, overriding feelings of, depression and anxiety, that you actually see a health professional, and that you do take something that is going to work on that chemical balance in a safe way. And then as we, through counselling, or, whatever other therapy it may be, bring up your coping mechanisms such that we can slowly wean off that other one, and the medication, and by incorporating a good daily routine through exercise, where you're going to get your natural endorphins, and you're going to feed your body with good food, real food, not something that's processed or junk, or that's come high in sugar, that's come out of a packet, because that's also going to bring your mood down. Again, sugar, it's another sort of, people take it because it gives them an immediate a burst of dopamine, and you feel great. But as soon as that's over, you go down, and and what happens is that fuels that addiction, and then you start getting negative body issues and things like that. So it's a sort of it's a vicious cycle. So what I would say is that if you want to do something, break that cycle. Work on your mental resilience. And you're only going to be able to be mentally resilient if you first recognize that there is a problem there to start with. If there's not, that's fantastic. We can all work on our mental resilience by doing these simple things of, exercising, breathing well, trying to minimize, our time on devices, particularly, late at night, because that, blue light, after 8 p.m. is going to interfere with your sleep-wake cycle. And as it is in lockdown, everybody's off, all their cycles, it's off. But it's very important. I mean, we're creatures of habit. Yes. We need to have a routine. And routine is very helpful, for our physical health and for our mental health both.
And, thank you so much for being here, because I think it's so important to have these conversations. And I just want people to feel and realize that there's nothing to be ashamed of. You could have a condition, you can go and get help. And some people also consider it to be a kind of a weakness to have, or have these uncomfortable feelings, and they don't want to talk about it. But I think it's maybe time that we had these conversations and convert those weaknesses, perceived weaknesses, into and change them, for ourselves, and transform our lives inside out.
100%. Yeah, 100%. I couldn't agree more. And I think that, it's very concerning that this stigma is there, and that it leads to people not getting help and taking that awful decision of, taking their life, where, that causes, so much pain to everyone around them. And it's so preventable, that, you need to have the courage to actually seek help, because it's incredibly easy to actually start feeling better. All it takes, as I said, is to voice those tears and fears, put them in words, and then talk to somebody about them and get help.
Yeah, I love that. I think I'm going to do that exercise myself and, get back to you, because I think it's fantastic. If you could give words to your fears and tears, what would they be? Lovely.
Yeah.
Well, if I could give words to how I'm feeling right now for having you on the show, it's going to be lots of love, lots of gratitude, and hopefully someone out there is watching this and benefiting from this in some way. Thank you.
No, thank you, Neha. Thank you for having me, and thank you for your whole platform and for bringing this up. It's extremely, extremely important, as I said, and I'm really hoping that I get to meet you in person one day very soon.
Yes, on the other side of this.
On the other side, which will come. This too shall end.
We will be resilient, and we will.
We will be resilient. Yeah, this too shall pass, and we will party together with some deep breathing.
Yeah. Box breathing.
Box breathing.
Gracias.